Introduction. Welcome to today's lecture on transverse myelitis, an inflammatory disorder affecting the spinal cord. This complex condition involves a wide range of neuroanatomical, pathophysiological, clinical, and management aspects. Understanding the intricate details of transverse myelitis is crucial for medical professionals to accurately diagnose, treat, and support individuals with this condition. In this lecture, we will explore the neuroanatomy and its relevance to transverse myelitis, pathophysiological mechanisms, epidemiology, clinical presentation and neurological deficits, diagnostic tests, distinguishing from other similar conditions, management and treatment options, long-term outcomes and prognosis, potential complications, multidisciplinary rehabilitation, current research and advancements, effective communication, patient education, and support for individuals with transverse myelitis. Let us delve into the complexities of this fascinating condition. Transverse myelitis involves inflammation of a segment or multiple segments of the spinal cord. Understanding the neuroanatomy of the spinal cord is vital in comprehending the pathophysiological mechanisms underlying this condition. The spinal cord can be divided into different regions, consisting of gray and white matter. The gray matter plays a key role in processing sensory and motor information, while the white matter contains ascending and descending tracts transmitting these signals. In transverse myelitis, inflammatory processes disrupt the normal functions of these structures, leading to various symptoms and deficits. The location and extent of the inflammatory lesion within the spinal cord determine the clinical manifestations experienced by affected individuals. Therefore, a thorough knowledge of neuroanatomy is indispensable in assessing and managing transverse myelitis cases effectively. The pathophysiological mechanisms underlying transverse myelitis involve a complex interplay of immune-mediated processes, including both innate and adaptive immune responses. The initial trigger for the inflammation in most cases remains unclear, but potential causes include viral or bacterial infections, autoimmune disorders, and demyelinating diseases. Upon activation, immune cells infiltrate the spinal cord, releasing pro-inflammatory cytokines, chemokines, and other molecules that further propagate the inflammatory response. This cascade subsequently damages myelin, axons, and supporting cells, disrupting normal neuronal functions. The resulting spinal cord lesions and inflammatory infiltrates contribute to the neurological deficits observed in transverse myelitis patients. A comprehensive understanding of these pathophysiological mechanisms aids in the development of targeted therapeutic approaches for managing this condition effectively. Transverse myelitis is a relatively rare condition, making its accurate epidemiological characterization challenging. However, studies suggest an annual incidence ranging from 1 to 8 cases per million individuals. The condition affects all age groups, with a bimodal age distribution, peak occurrence in the second and third decades of life, and a smaller peak in older adults. Transverse myelitis displays no gender predilection. While it can occur sporadically, certain infectious and autoimmune diseases are associated with an increased risk of developing transverse myelitis. Precise epidemiological data is crucial for understanding disease prevalence, risk factors, and tailoring preventive strategies and healthcare resources accordingly. The clinical presentation of transverse myelitis is characterized by the acute or subacute onset of various sensory, motor, and autonomic deficits. Sensory symptoms often encompass pain, tingling, numbness, and temperature and proprioceptive disturbances. Motor deficits manifest as weakness, spasticity, and loss of coordination. Autonomic dysfunction can lead to urinary and bowel disturbances, sexual dysfunction, and cardiovascular abnormalities. The severity and extent of deficits depend on the level and extent of spinal cord involvement. A detailed assessment of clinical manifestations and neurological deficits allows for accurate diagnosis and formulation of appropriate management strategies. Accurate and early diagnosis of transverse myelitis is crucial for favorable patient outcomes. An interdisciplinary approach is necessary, involving detailed clinical evaluation, neuroimaging techniques, lumbar puncture, and laboratory investigations. Magnetic resonance imaging, MRI, plays a central role in identifying characteristic spinal cord lesions, determining the extent of inflammation, and ruling out alternative causes. Cerebrospinal fluid analysis aids in differentiating inflammatory from non-inflammatory etiologies and helps exclude infectious or malignant processes. Additional laboratory tests may be conducted to identify underlying autoimmune conditions or infectious agents. Integrating the findings from diagnostic tests helps confirm the diagnosis of transverse myelitis and differentiate it from other similar conditions. Transverse myelitis shares clinical similarities with several other conditions affecting the spinal cord, making accurate diagnosis challenging. Establishing a definitive diagnosis requires ruling out alternative etiologies such as multiple sclerosis, acute viral myelitis, spinal cord infarction, and compressive myelopathies. Thorough clinical evaluation, neuroimaging, laboratory investigations, and careful consideration of the temporal profile and symptomatology aid in differentiating transverse myelitis from these conditions. Collaborative efforts between neurologists, radiologists, and other specialists ensure accurate diagnosis and appropriate patient management. The management of transverse myelitis involves treating the underlying cause, managing symptoms, and preventing complications. Immunosuppressive therapies are employed to halt the inflammatory processes, prevent further damage, and facilitate recovery. High-dose corticosteroids are the initial treatment of choice, often followed by intravenous immunoglobulins or plasma exchange in refractory cases. Symptomatic relief can be achieved through pain management, physical therapy, assistive devices, and bladder and bowel management strategies. Multidisciplinary care, involving neurologists, rehabilitation specialists, pain physicians, psychologists, and social workers, ensures comprehensive and customized management plans for individuals with transverse myelitis. The long-term outcomes and prognosis of transverse myelitis vary considerably among individuals and depend on several factors, including the extent of spinal cord involvement, severity and duration of neurological deficits, age at onset, presence of comorbidities, and timely and appropriate management. Some patients recover completely or experience only minor residual deficits, while others may be left with significant disabilities requiring ongoing support. Longitudinal studies have highlighted the importance of early diagnosis, prompt treatment, and comprehensive rehabilitation in improving patient outcomes. Understanding the factors influencing prognosis aids in setting realistic expectations and tailoring therapeutic and supportive interventions accordingly. Transverse myelitis can give rise to various complications that impact an individual's quality of life and overall well-being. These complications may include chronic pain syndromes, spasticity, bowel and bladder dysfunction, sexual dysfunction, pressure ulcers, respiratory complications, and psychological disturbances. Effective management and timely interventions can help minimize the impact of these complications, necessitating a holistic approach encompassing medical, rehabilitative, and psychosocial interventions. Recognizing and addressing potential complications contribute to improved patient outcomes and enhanced quality of life. Multidisciplinary rehabilitation is pivotal in addressing the functional impairments and disabilities arising from transverse myelitis. Rehabilitation programs aim to optimize physical, psychological, and social well-being, enhance functional independence, and improve overall quality of life. These programs typically include physical therapy, occupational therapy, speech therapy, psychological counseling, vocational rehabilitation, and social support services. Rehabilitation specialists collaborate closely with patients, families, and caregivers to tailor individualized programs that address specific deficits and provide ongoing monitoring and support. The comprehensive nature of multidisciplinary rehabilitation enhances the prospects of successful recovery and reintegration into daily activities. Ongoing research efforts continue to expand our understanding of transverse myelitis and drive advancements in its diagnosis, treatment, and management. Studies focus on unraveling the precise molecular mechanisms driving the immune-mediated inflammatory responses, identifying potential biomarkers, and developing novel therapeutic approaches. Innovative imaging techniques, including functional MRI and diffusion tensor imaging, are being explored to better assess spinal cord integrity and functional recovery. Furthermore, advancements in regenerative medicine, neurostimulation techniques, and assistive technologies offer promising avenues for improving long-term outcomes for individuals with transverse myelitis. Staying abreast of current research and advancements ensures that medical professionals can provide state-of-the-art care to their patients. Effective communication, patient education, and support form the cornerstone of patient-centered care for individuals with transverse myelitis. Open and empathetic communication, involving ample time for discussing concerns, addressing questions, and promoting shared decision-making, fosters a strong therapeutic alliance. Patient education is crucial in helping individuals understand their condition, management strategies, and potential outcomes. Providing information about support groups, community resources, and assistive technologies empowers patients to actively participate in their rehabilitation journeys. A comprehensive, patient-centered approach ensures that individuals with transverse myelitis receive the necessary support and resources to navigate their condition successfully. In conclusion, transverse myelitis is a complex neurological condition that demands a detailed understanding of its neuroanatomy, pathophysiological mechanisms, clinical presentation, diagnostic tests, management strategies, long-term outcomes, potential complications, multidisciplinary rehabilitation, current research, and effective communication. Medical professionals must invest the time and effort to stay updated with advancements in this field to deliver optimal care to individuals with transverse myelitis. By combining scientific knowledge, clinical expertise, and compassionate patient-centered care, we can make a positive impact in the lives of those affected by this condition. Thank you for your attention, and I hope you found this lecture informative and thought-provoking.